So thank you. Taking the time to spend your lunch hour with us today. So with no further ado, I'm going to take just this first few moments to, first of all, you probably noticed I'm not keen. Still Howard isn't with us today, so he had a personal engagement that he had to attend to. So I agreed to kind of hold the fort down. So I'm not Boone. I'm the Director of Marketing, Community Relations and Development with Norton King's Daughters Health. I actually am fighting just a little bit of some congestion, so excuse my voice today. And it's nothing contagious, so you don't have to feel like I've got this big shield around me, but I will try to keep my distance from everyone. I wanted to mention that the Recovery Cafe will launch on January 31st. You have some information about that if you picked up handouts. And you can watch for their Facebook page and also the website, which is recoverycafemadison.org. This is a really, Alicia Cornelius is hired as the executive director, and this is a really exciting step forward for all of us who've been working in the substance abuse arena for some time, because recovery programs are very much in need in a community that is always trying to recover and always trying to move forward. So we're very excited about the growth and development of that program, and more to come on that. I want to also mention, if you didn't pick this up, make sure that you take just a moment to look at the save the date for Wednesday, April 19th. This is the Jefferson County Adverse Childhood Experiences Conference. It's going to be held at Courtney Inn. It will be free, and we have national experts coming to talk about adverse childhood experiences and how they affect trauma and affect all of us in our everyday lives. So we're really excited about this. We're anticipating hopefully have even up to 200 people at this conference. So I invite you to mark this on your calendar, because we're going to be just thrilled to death to be able to bring all this information to you. And no matter what your avenue of interest is, whether it's in law enforcement, whether you're in social services, if you're in healthcare, if you are in law enforcement, I think I already said that. There will be things of interest for you in terms of adverse childhood experiences and how they affect our community and how we move forward with knowing about adverse childhood experiences. So please mark your calendars for that. If you are interested, also I wanted to mention, Keith wanted me to mention the Staying on the Road to Recovery, which is currently slotted for February 23rd, 2023. This is going to be Aisha will be sort of spearheading this project, and Brad Pitt Pike as a panelist. We'd like to have 2 more with a total of 6 possible panelists to discuss recovery and answer questions on recovery from those who are actually have been in recovery. So right now it's slotted on the 23rd from 6 to 7 p.m. So I invite you to take a look at this, and if we have a chance, I'm open to feedback about that after Mayor Courtney's had the opportunity to give his presentation today. With that, Bob, are you ready? I know you had a couple things.
Yeah, whenever you're ready.
You're ready to go. Okay, so I'd like to take just a moment to introduce Mayor Bob Courtney. He's a lifetime native of Madison. Bob spent his career in banking and finance, where he was involved in over $5 billion in investments across the country. After retiring in 2018 from a very successful career where he earned his CPA and securities licenses, Bob has applied his passion to everything Madison, and he took office in late 2019. He is a graduate of Ball State University, and has a degree in finance, and is a graduate of, is it Stonier? I didn't know how to pronounce it. I was like, I need to ask it ahead of time, but I forgot. So Stonier Graduate School of Banking at the University of Delaware. Since taking office, he's been focused on public safety, economic opportunity, and quality of life initiatives, developing strategies for public health, blight elimination, park improvement, and public safety. Hey there.
How are you, ma'am?
I'm great. Bob is also a member of the Legislative Committee of AIM, who was appointed by Governor Holcomb to the Indiana Public Health Commission, and honored to be part of a state presentation from the team for the Southern Indiana region. Recently secured $50 million. That's right, $50 million in economic development grants. Bob's also vice president of the Indiana Conference of Mayors. please welcome our City of Madison's 36th Mayor, Bob Courtney.
Happy to be here. Notice you didn't say Dr. Mayor or Dr. Bob, so I'm here, you know, as the mayor of Madison and a member of Governor Holcomb's team, but I'm not a healthcare professional. And I know the focus today is talking about the work on this and
Wrong one.
one.
Two clickers.
Wrong clicker. And let me get oriented here. Is that? If you want to, maybe there's an on off button. Well, we're figuring that out, but so Governor Holcomb formed the Public Health Commission approximately about a year ago, and there was probably around 30 people from across the state of Indiana from all different sectors of the state. There was administrators, public health officials, doctors, educators, and three of us out of that group were in the public policy arena. So I was the only mayor in the state that served on the commission, and there were two county commissioners from two of the larger counties across the state that served on it. And really the goal of it, and I commend Governor Holcomb, it was really about what can we do to create healthier outcomes. And you know what Governor Holcomb's vision has been, and I think this resonates throughout the entire state, is you have to be willing to make a proper investment, whatever that might be, and do it in a data-driven way that creates measurable outcomes if you are going to ever move the needle. And that's what we were attempting to do with the commission, not only collecting lots of data. We probably spent about 6 months just doing data collection and evaluation, but there was also a lot of public testimony, listening sessions, public input sessions, a lot of feedback in these meetings relative to where are we, who do we want to be as a state, where do we go from here, how do we get there? And at the end of the day, it really resulted in the fact that the state of Indiana, compared to its peers, really does pretty poorly, stacking up in many categories relative to public health. And the lack of investment over a very, very long time has kind of brought us to where we are today. And in order for us to change the future, we've got to be willing to make proper investment in order to get those outcomes that we desire. So that was really the premise of the Public Health Commission, which was to look at where we are all across the state and understanding the importance that public health has on our quality of life, on our child's, on our children's, in our community quality of life, on our workforce. And if we're ever going to grow and continue to grow our economy, we have to have a very healthy workforce. Statistically, and I'll go through here now and just push a couple of buttons.
Forward, backward.
So there's some really positive things about the state of Indiana: our affordability, opportunity, investment in pre-K through the 12th grade. You can see we're 9th in the nation. We have a growing economy and public safety. But when it comes to public health, we are really far down. In fact, Indiana is one of the worst states in the country for many categories that are being measured. High use of smoking and tobacco, obesity, growing mental health issues, poor rankings for childhood immunizations. And the bottom part here, 50 states, and we're ranked number 45th with regards to public funding. And if you look at what we do at the local level, about how fragmented really management of public health is across the state, and the fact that a lot of local community health decisions are made, in the council, at the council and commissioner level, Governor Holcomb and the commission really made the right call, which is the fact that we're ever going to be making a big difference and changing the trajectory of the state of Indiana relative to our peers. And if our economy is going to continue to grow, and if we want to offer a high quality of life for the people that live here, just like anything else, we've got to make a much stronger level of investment. And the first investment we can make is in ourselves. That's certainly something that we deploy here as a strategy in the city of Madison. Let's invest in the city of Madison so others will want to invest in us. But being ranked 45th in the country is not one of our things that we brag about very well. How does all this play into our lives here? Despite all of the modern progress in healthcare, our life expectancy has actually been decreasing. And what was interesting about the findings through the Public Health Commission is the fact that you could drive up I-65, and as you go from county to county, you'll get a different result relative to life expectancy. Where our life expectancies ought to be increasing, they've actually dropped a couple of years. I believe now the average life expectancy here for Jefferson County is right around 76 years old. But in other areas, other parts of the state that are making bigger investments at the county level in public health, it's a couple years higher. And in the highest to lowest across this demographic here, I believe it was about 9 years. So to the extent that where you live determines how long you live, Governor Holcomb really, I believe, and the Public Health Commission's recommendations was that we shouldn't have that type of disparity across the state. Here at the local level, I just throw a couple of statistics out for you. But again, the funding of the local health department comes through the county budget. And in 2023, the approved budget that was just published is about $769,000 for the entire county. And that is the taxes that support public health in Jefferson County is less than 1 cent per $100 of value in property taxes. And it's decreased from last year. Last year's budget went up slightly, but it pretty much is even, and all counties are really suffering from this. If you're in a county that really doesn't have high growth rates in assessed values or high income levels, you're not going to make bigger investments in public health. But if you're in central Indiana and you're in Carmel, you're in Fishers, you're in Noblesville, you're in those areas that are more affluent, then what do? They make bigger investments in public health. And public health isn't just about what is delivered at the local health department level. It's about also what the city and the county and the states do to promote public health across the community, health and wellness. And I think that is something that we have got to continue to be investing in. And that's also another key finding too, is how our public health isn't what's delivered to the doctor's office. It's about the choices and availability of different types of health and recreation and mental health and recreation that's available to the people that live here. So really it's about the choices and behaviors that we make outside the doctor's office that dictates a lot about public health. And you can see here, just what I was talking about, the highest and lowest is almost 9 years. It's really unbelievable to think that if you drive out of Jefferson County and go to if you lived in a different county, you might live 5, 6, 7 years longer. We went through the rankings here. Did you know there's 94 local health departments in the state? So the delivery of public health is really fragmented. Now, when the Public Health Commission started, there was lots of ideas about, well, how do we improve outcomes? And some of the initial suggestions was, well, it's simple. State has to take it over because the job isn't being done effectively at the local level. There was a lot of resistance to that thesis because public health is best delivered at the local level. And we really, those of us that are on the policy side, we push back to the fact that we don't want the state to take over our local health delivery systems. We want the health delivery to be done at the local level. The best response we're going to get is when it's more personable and when it is one-on-one. But as we mentioned here, most of the local public health funding comes from local government and it's property tax driven. So, property taxes go like this. And oh, by the way, the state of Indiana has a constitutional cap on how high property taxes can go. So even if our need is greater, even if our properties are growing, there still is a cap on the funding. And with all the demands at the county and local level from a government, like the county level, you gotta take care everywhere. You gotta take care of your road, your sidewalks. Public safety is a big expense at the county and local level. The county jail, for example, the property that all of our governments own. Those all in the ranking of priorities at the local level, those all get taken care of first. And of course, you have to have people to run local government and county government. So there's not a whole lot left over when it comes down to making proper public health investments. And it creates a huge dependency. Last night, we gave a presentation to another group. We were talking about, well, how our cities funded. Our backs, cities and counties' backs are always against the wall because there is constitutional limits on how much you can borrow and leverage up your tax base. And there's constitutional limits on how much you can tax the people that own property. And then there's also, by ordinance, limits on how much you can tax income. So there's a lot of work that has to go into creating revenue streams, which then, because we can't really fund all of our needs 100%. We have to pursue state and federal grants to offset the additional revenue that's needed. But what that does is it just keeps suppressing investment. Well, Governor Holcomb's Public Health Commission had a recommendation for that, which is if you're ever going to change the future destiny of Madison and the state of Indiana and Jefferson County, you gotta go back to the basics, which is you gotta have a bigger investment, and you've also got to have people willing to make different choices behaviorally, so that they can live longer, healthier lives. Funding per capita ranges from $1.25 to $83 per capita. And statewide, I think we'll get into that. I think it's probably nationwide per capita, the investment is about $90 per person. Here in Jefferson County, anybody want to take a guess on how much we're investing in the county for public health per capita? Anybody just throw a number out?
75 cents.
75 cents? 20? $5? A little over $2. So we're a long way, right? But we've also got to continue to make these big investments. And health and wellness, comes in lots of different forms. It's access to services, but it's also giving people an opportunity on their own to be healthier. Trails, you hear a lot about trails, outdoor recreation, things that quality of life measures, all of those things play into our health. And you'll see lots of new investments coming across that way. But at the end of the day, cutting to the chase here, the Public Health Commission's recommendation was we need to increase funding at the state level that then gets distributed down across every county across the state by $250 million a year. That's a lot of money when you're going to a legislator and asking them for money for public health. And they're looking at roads and bridges and buildings and all the other needs that come. It's going fast here. So there was a lot of these different work streams that we talked about. And it really focused on these key areas. First was governance, infrastructure, and services. So how should the state interact with local health departments to improve healthier outcomes that are measurable? And what we concluded was the state needs to be more involved. They need to provide more resources at the local level. They need to provide more money at the local level, but they can't be in charge of the delivery of services at the local level. So through this particular stream, it's about a partnership, and it's creating additional staff and resources at the regional district level. And effectively what they're going to be what they're proposing to the legislature is that they create this well-funded local health maintenance fund, essentially. that then can be distributed through the Department of Health down to the local levels based on plans that the local level would have to implement better public health outcomes. And there's also a co-investment. And I believe in this too, is that as we talked about, the best investment we can make is the investment in ourselves. What they're proposing is an opt-in and opt-out structure. The state will give money at the county level. The county level also has to step up relative to the amount of investment it's willing to make. And that way we've got this partnership where there's a co-investment. It's about, being willing to, put your money where your mouth is, so to speak. And if we want the state to support our initiatives for better health, we also need to first be willing to do that. And how do we do that? Again, it's all very systemic. We've got to get more money into at the local level to be able to afford those matches. And that's why it takes a lot of heavy lifting, because when you think about all of these barriers that's in local government's way, for good reasons, sometimes they are in conflict with one another. And so it takes a lot of legislative involvement here. And so as we get through here, what we're doing is advocating with our state legislature all the time. They're now in session for the next 4 months, or they'll be determining the state's budget for the next 2 years. This will be the last budget for Governor Holcomb. And last week I was in Indianapolis where he announced his 2023 next level agenda. And here's what he had to say about public health. And it's translating into dollars. But this was from last week's reveal of his key initiatives. Transform the quality of public health in all 92 counties by investing in local health services. Complete the implementation of My Healthy Baby in 10 more counties to reach full coverage. Build a sustainable mental health system to support, prevent, and respond to crisis. Prevent suicide among veterans by implementing the Governor's Challenge Program. And keep focus and commitment on Hoosiers battling substance use disorder. And in his budget for how are we going to pay for all these initiatives, he is proposing for fiscal year 2024, $120 million of additional funding. And in 2025, $227 million of additional funding. And it's broken out in funding for local public health, state level funding to support local initiatives, emergency preparedness, nothing like a good old pandemic, right? To teach us how well prepared we are for responding to emergencies and crisis. And part of that emergency preparedness is improving the state's strategic stockpile, trauma system improvement, and a big investment in emergency medical services. These are, again, state level, working down to the local health department level, and then engaging across all spectrums of the community. Local business, health providers, schools, other governmental and non-governmental organizations. What's really about providing more resources. If you look at kind of the foundational type services that are performed at the local health department level, I mean, it is absolutely incredible the job that they do with the limited resources that they have. And then if you say, well, if we had more resources, just think what the possibilities are. And that's really the goal of Governor Holcomb's Public Health Commission is unleash the talent, recruit better talent, so we can have better outcomes. In Jefferson County, what the implication here for all of us with regard to health and state of Indiana, and I'll just speak from an economic development perspective, is we've got to have people in our workforce who can fill the jobs that we need for growing industry and business in our community. That then creates a benefit for our community to help us invest in quality of life measures. But in Jefferson County, only about 56% of the people that live in Jefferson County participate in the workforce. Statewide, it's only around a little over 60%. That puts an enormous amount of pressure on communities to grow. You've probably read in the paper about a lot of our economic development priorities here, and we're bringing in hundreds of jobs. And the question we get all the time is, where are we going to find the workers? We've got to be able to invest in our communities for a high quality of life, to attract population growth, not just, from the region, because we don't want to just do body swaps. We've got, and this is the goal again, statewide, is get people to move to Indiana. Put Indiana on the map. And when Indiana is on the map, all of our communities become more capable of growing as well. And again, as we change our workforce paradigm, we need more people in our workforce, and unhealthy people can't support our growing needs in our workforce. And what it does, it creates even more pressure on the state and the local community to supply workforce labor, be able to attract business, but also support those people who live here who are out of the workforce. Here are the core services at the local health department level. I won't go through all those individually, but those are, like I said, foundational type services. We went through all of that. Well, what are the local health departments doing? What could they be doing if they had better resources? And we went through a whole bunch of different studies and interviews and public testimonies about this. And by the way, all the findings of the Governor's Public Health Commission, I believe, Hannah, didn't we put it on the City of Madison's website? I think it's on our website. If not, we'll make sure it gets on our website. It's definitely on the Department of Health's website too. You can go through it. It's a very lengthy document that has all these different work streams, because again, it broke it down in so many different categories relative to the work streams, and then distilled it down into all the various different goals and priorities in that particular work stream. And it was across the board of governing the different services, the funding element of it, how services were distributed, and then how the state Department of Health and the local health departments interact with one another to provide the services. But the core of all this was, a healthy community is so vital. It's just absolutely so vital. We have to make bigger, stronger investments in it along the way. Additional services, we talked about tobacco prevention, some things that, again, the state of Indiana ranks very poorly in: harm reduction, school health, full-time public health nurse, equitable delivery of core services, maternal and infant mortality. And then here are the recommendations. Indiana is at $55 per. So I mentioned that the county, Jefferson County, is at $2, right? It's funded by our taxes. And what we have to do is go to the state and to federal government and apply for grants to get that number up. So they do a great job with what they have, but the annual budget for the health department, is less than $800,000 a year. And that's got to go across, 34,000 people that live in our community. There's going to be an 80-20 cost sharing. So as the county commissioners, county council look at what the parameters are to receive the funding, there's going to be a co-investment piece of that. And the counties can opt in or opt out. They may not be able to opt in. They may say, we can't afford this. Or they may have to throttle back how much financial support they get from the state. But the state is really, really serious about this. When I say the state, I know that Governor Holcomb and from a public policy perspective, we all agree it's the right investment to make. What better investment can we make, again, in health? But there's lots of demands on resources, and it's going to be up to the state legislature to approve the budget and agree with or throttle back some of the recommendations that we recommended. $250 million a year what needs to be invested. Governor Holcomb took our recommendations, and the first year, as I mentioned, $120 million, and the second year, $250 million. And we believe that what better use of the surplus that the state has than investing in the people, because it's the people that is going to make our state and local communities more successful. But we've got to get the amount of investment way up. And that's what this attempts to do. The $250 million was framed up from, hey, if we just want to be average, hey, how's that for a goal? Let's just be average, right? Let's just get from being near the bottom to being average. And that's going to take $250 million a year. But like everything, you can't go from 0 to 50 right away. You're going to have to phase it in. And that's what this does. But it's got to become a part of our annual funding in a much more material way. Through here, I talked about the opt-in and opt-out counties. None of this is going to be achievable until we get through this budget cycle. So watch the news and see how the legislature responds to the need, to the data that's in here, as well as a request from the governor's office for funding. There's lots of things in there. So for example, economic development, the governor's recommending another $500 million be distributed across the state for economic development. The return on that investment is proven to be huge. I think when Najee was talking about my bio a little bit, I was on the state presentation committee for the Southern Indiana Regional Development Authority, and we were successful in getting a $50 million award to competitively distribute across the 5-county region, which Jefferson County is part of. And we've been able to take that $50 million and turn it into $1 billion. That's the return on investment. That's really, truly measurable. Statewide, that $500 million was turned into $10 billion. So there's no doubt that investing in economic development also helps all of our communities. But at some point in time, we're going to have this obstacle, which is, it's great, we can attract new investment, but where are we going to get the workers from? We can be competitive and bringing more investment dollars to our state, but we are already at a deficit relative to our workforce. There's going to be a regional and district infrastructure. That's how this is going to flow through down to the county level. But it's really coming down to, in a most simple, basic term, a statewide local health maintenance fund that will be funded specifically in these different categories to the Department of Health, that will then work with each county in developing their plans, their strategic plans and initiatives to improve healthier outcomes at the county level. And then the dollar amount will be assigned to that. And there'll be, again, I'm trying to really simplify it, which is, all right, let's say it turns out to be, $100,000. It's a base term. Well, 20,000 of that has to come from an appropriation at the county level, and 80,000 would come from the state. The numbers are going to be much bigger than that because we're talking about $120 million in the first year and $250 million in the second year. The numbers are going to be bigger. But the bigger the state support is at the local level, the bigger the co-investment at the local level has to be too. And it all has to go through a council appropriation level. Workforce recommendations. There's a deficiency in public health providers all across the state. And really finding people who want to go into that type of healthcare. So they're also trying to figure out ways, when you get into that, well, how do they attract more students of public health education? How do they recruit, train, and retain? We're dealing with that at every segment of government. How do you recruit talent, train it, retain it? 30% of the students that go to college in Indiana leave the state. So there's already a brain drain going on, and that's not good for the state of Indiana. And not even factoring in the fact that on average, about 15% of high school students across the state of Indiana drop out. And it's not like they are going on to some of the great programs like here at Ivy Tech. They're dropping out. And they're not coming into the workforce, or they're coming into the workforce and some of the fastest, and it's not one of these stats that's up here, but some of the fastest growing jobs actually across the state are at the lowest educational level. And what that's doing or I should say not doing, is it's not creating prosperity, and it's not moving the needle on those who are impoverished. And it's creating the need for more social safety networks. So there's this whole we're talking today about public health, but the implications are just so dramatic when you start distilling it down to all these different common denominators of what you need for a community and for a state to grow. We're all here, as advocates for everything Madison and Jefferson County, but we're part of a big region, which is part of a state, which is trying to change the direction that it's been on for the last quarter century to where we can improve these outcomes, create more better educated workforce, because the workforce demands are much higher. And it's, go to any of our manufacturing companies here, and Indiana is one of the largest manufacturing states in the country, and the needs for advanced skill levels at the manufacturing environment is growing. Automation is one that is continuing to, again, change the whole landscape of our workforce. So again, it all comes back to planning. They are going to establish the State Health Workforce Council that brings our health agencies into it as part of workforce development. Anything that you can do well, you're going to plan for it. And we know that is so true. And again, coming back to a little bit, bringing it back home, we had been working on economic development planning for years, waiting for the right opportunity. And the last couple of years, particularly with the READY grant and other programs at the state and federal level that were competitively based, if you already have that plan, then you can execute really, really well, and you'll be ready to take advantage of opportunities when the funding becomes available. And if not, somebody else will fill that void for you. They always will. There's counties out there that are already figuring out, how do we improve our life expectancy? How do we grow our workforce? How do we make our community more prosperous? How do we grow property tax values? How do we create more revenue for our city to reinvest in all of these things that we all know is so important, which is our quality of life? And we're not doing it, somebody else is doing it, and they will get the money. And at the end of the day, it comes back to what I said at the very, very beginning, which is the power of investment. And you got to be willing to make those investments across all spectrums to get the right people in the right places at the right time, and get them here now. But we really have run out of time. I spoke to a large chamber event down in Southern Indiana about a month ago. And one of my opening remarks was, boy, isn't it funny how fast a quarter century goes by? I can say that now that I'm almost 60, but a quarter century flies. And you start looking backwards a little bit in the rearview mirror in the context of what you need for the future. And you figure out, boy, we should have started on this 25 years ago. Because time really does catch up to you really, really quickly. But you can always reverse it, and you can plan better for the future. The emergency preparedness, we went through one heck of a time, didn't we? Getting through COVID. Did we ever think we were ever going to get out of that rabbit hole? Every single day in City Hall, we were looking at a new executive order. Sometimes those executive orders were 12, 15 pages long. At the local health level, they were doing the exact same thing, trying to figure out, how do we keep our community safe? How do we keep our businesses open? It took a long time, but we also learned probably what were the chinks in our armor there. What were some best practices that we can now adopt for the future? And emergency preparedness is one. In the 3 years that I've been mayor now, going on 4, we've had COVID, which really turned everything upside down. We had a natural disaster, which was a major flood that created millions of dollars of damage that had been going on for over a century. So we've got to constantly be, addressing solutions that are focused on the future. Otherwise, we're just going to keep, hoping, wishing. We're going to keep reoccurring these issues. But EMT, emergency medical services, is something that the that's really on the state's radar, because that's so important, being able to respond to emergencies, being able to deal with trauma. And we know what impact that can have on everybody's lives. So being better prepared in the future is also part of all of this investment that we're talking about. In fact, I have a breakdown here of Governor Holcomb's recommendations to the state legislature. And probably around $25 million of this new investment would go toward emergency preparedness. The biggest part of the investment over the next 2 years is going to be funding for the local public health, which is to local health departments and schools, full-time public health nurses, staffing to deliver improved core services, technology, security upgrades, and a focus on maternal and infant health initiatives, as well as injury prevention. Data is a really big one. Collecting the data. If you don't know where you're at, you don't know where you're going to go, you got to have measurable outcomes. Anytime we're out there seeking financial assistance, we got to come with the data. And we've been very focused on preparing the data, even as hard as it is sometimes to collect data. It's really, really important. But the data is what tells the story. And that's what Governor Holcomb's story is to state legislature. It's telling the story about the state of Indiana and the state of our public health and the level of investment. And now is the right time to really, propel the level of investment, because as you know, the state has been enjoying really strong surpluses in its budget post-COVID. That's not going to last forever. So if you continue to kick the can down the road and you don't make the investment when you have the resources, you're going to find yourself again at another disadvantage where the resources aren't there and the need has only gotten stronger. Look for across the state, like I said, a public health data system advisory committee. They're going to figure out how do they deploy this new money to the local level. So FSSA, Department of Health, they'll be probably forming another advisory board to make sure, how do we roll this out? But local engagement is going to be extremely important, like it is with everything else. Next steps, spread the word. So all of us interact frequently with people from all walks of life, and particularly the other policymakers. So we need to be advocating to the legislature to support these initiatives. As Nadja said, I don't think if you're all familiar with AIM, but it's Accelerating Indiana Municipalities. It's a statewide advocacy organization for municipalities. County has the same thing. They have an association, and it's an advocacy group. And I'm on the state legislative committee, and what we do there is we assemble priorities that we all have in common. All of us mayors get together and we talk all the time, and we have the exact same issues in many respects. Sometimes it's bigger and smaller. The scale of it changes, but we generally dealing with, that we want the same thing for our community. We want our communities to thrive. We want our quality of life to be high. We want to be able to make tremendous investments in our people of our community. And the way we do that is to be advocating at the policy level, at the state level. And so we can't take for granted what happens in Madison stays in Madison, because what happens in Indianapolis affects everybody in Madison and Jefferson County. And I can someone that spends a lot of time on the policy aspects of good government, that all those roads lead back to Indianapolis or with our congressional delegation in Washington, D.C. So we are always in front of them advocating. And that's what we have to do here. This isn't just Governor Holcomb's fight to pick with the state legislature about, hey, here are my priorities. What do you think? It's all of us saying, let's get behind him. Let's learn and educate ourselves about what changes and what changes this opportunity has for us and how it can transform our community. But the power of that investment, everywhere you go, you've got to be making investments. If you're not investing, you're dying. And like I said, a quarter century goes by really, really fast. And here we are all across the spectrum, high demands for very, very large capital intensive investments. But the number one investment that we can all make is the investment in the people, and the health of people, can't be understated, because that drives everything. It just drives everything else, drives our economies. And if we want to live in a growing, prosperous, high quality of life community, we've got to have really good economies. And to have a really good economy, you got to have a really solid workforce, and you've got to be able to offer all types of services and amenities across the community. And it's not cheap. Just a little old city of Madison, we have over $100 million in assets that we have to maintain. We have between 350 and 400,000 visitors to our community every year. A population of Madison can double or triple in a weekend. And we have to be prepared for all that impact. We can't think like a 12,500 city or a 33,000 county. We're part of the Madison and Jefferson County is part of the fastest growing region in the state. All the counties that were part of this RDA that border Kentucky, we're the fastest growing region of the entire state. And that's why we've got to always be in front of the governor's office, our state legislature, our congressional district, and we've got to be pulling that money to us. But we also got to be showing them how we're going to invest it so we get outcomes that are measurable. And over time, we'll start moving the needle. Well, anyway, spread the word. Can't emphasize enough. Talk with your legislatures. I'll be in Indianapolis later today, talking with them, and I'll be talking about this. And I'll tell you another thing. Here's another insight of a nugget relative to who else is talking with our state legislatures, lobbying groups. There's always somebody over there saying, give them the money, give the money to us. We need it. Or, cut taxes. And when they cut taxes, it's going to cut revenues to the city and local levels. And we're always fighting and debating about the push-pull effect, because there's always pressure to cut taxes. And you saw one of the very first statistics, affordability. We live in one of the most affordable states in the entire country. But every single legislative year, there's always somebody lobbying for a special interest group to cut taxes for that special interest group that takes money away from local and county governments. Always. And there's never been a time where more is demanded of us as a community than right now. And we are always debating, well, what kind of community you want to be. We want to be a community that's growing. We want to be a community where, our kids stay here. And as I mentioned, statistically, 30% of college graduates are leaving the state. We need them to stay here and contribute to our workforce to help us grow and attract capital. When you were announcing kind of scheduling some things you're going to encounter, I want to mention Public Health Day at the State House is January 26th. Governor Holcomb will be there. I tell you, the Department of Health has some fantastic leadership up there. And Dr. Box, she's the state health commissioner. She'll be there. A couple of other members of our public health advisory group will be there. Senator Luke Kinley, Dr. Judy Monroe, and former Congresswoman Susan Brooks. They'll also be there. It's from 11 to 1 at the Indiana State House. And it's Public Health Day. They're really going to talk about how do we invest in Hoosier lives to make Hoosier lives better. And then in conclusion, here's a website for the full report and recommendations. We went through a whole year long, I've got binders full of this much material about really trying to get the state of health. Tonight, Governor Holcomb will be presenting the state of the state, which he'll be focusing on his agenda, which is economic development and public health and education and workforce, big investment in education, community development, and good government. But we've got to keep making sure our voices get heard so that Governor Holcomb and our state representatives are focusing on what matters most to our community. But you can see the full report there. And again, I think I've talked a lot about what the implications are. And again, it's not just public health. Public health is, if you think about a bicycle with a hub and a spoke, public health really is at the hub. And you know, if you're not healthy, you can't work. If you can't work, your quality of life, the quality of life of everybody around the state is diminished. And I know that all of you all care about public health, healthy community initiatives. It's been fantastic, and on focusing on how to improve healthier outcomes. One of the things I'm passionate about is substance use disorder and bringing treatment options to the community. I've been working with the Jefferson County Commissioners for 3 years now, and this might be our year to actually get a program implemented in the new county jail. I visited several other counties on programs that they have. We also were participants in a class action lawsuit at the local level, at the state level, and federally. So between Jefferson County and the city of Madison, we received about $300,000 in that settlement. And that we have the power now to actually put some money behind what we're talking about of trying to curb substance use disorder. And there's many ways to do it. I just feel strongly that if we're going to build a $45 million jail, let's try to put the jail out of business instead of growing business at the jail. The only way to do that is stop recidivism. And when 90% of your people in those jails, two takeaways, and this is not talking to jail commanders. This is going inside jails and talking to people who are in the jails, locked inside jail rooms, candidly, with me. All of them experience some trauma as child. Adverse childhood experiences, what you all have been focused on with ACEs. I think you might have even mentioned that in one on one.
Yep.
It's real. Every single one of those people in the jail that I've spent about 3 hours with, that was just in that one jail in Jackson County. Every single one of them, because I asked the question, what was your childhood like? And every one of them had horrible stories. So what we need to do is give them tools. Jackson County, I think, has been a great example of investing in people and outcomes to stop that recidivism and improve and reduce substance use. But in Jefferson County, we have a major drug problem here, like all counties, and it's I equate it to trying to empty the bathtub with the water running. It's really hard because it just creeps over, it just overflows. But we gotta make a difference somewhere. My point of bringing that into this whole equation is, if we can figure out some real solutions to substance use disorders in our community, that benefits all of us, and it makes that investment in a new Jefferson County correctional institution, turns it into a resource for the community instead of just a place to warehouse of people that have broken laws. I'll stop there. Believe it or not, we're almost on time.
As I say, we've got a couple of minutes for
Happy to answer any questions, but I am not a doctor, but there are doctors in the room. So I might deflect. I can talk about finance, accounting, investments, policy, but I can't always cure what ails. I am married to a nurse. Yeah.
In all of the data that you collected, what was the percentage of folks with substance abuse disorder in recovery of our?
Oh, I don't know that. I'd have to go dig into that. We had binders and binders of data. They did collect that data, and that is a priority. But I don't have that. I don't have that stat. I'm sorry.
But it isn't.
Y'all with me? Yes, Jason.
Isn't an either or question. Either when you were going through these meetings, what shocked you the most, or where do you think is the biggest problem? Because like the biggest thing for one of the either one of those.
What shocked me the most, initially, there were some very diversified, strong opinions at the very beginning. And I think that was what was really interesting about the whole process, because it kind of took all of us that were, we'd already we kind of came in with opinions and biases. And the data started changing our minds that then got distilled down into recommendations. So I was surprised that there was that diverse of opinions about public health, because there were some people that had some really strong opinions in there that you should just do away with local health departments and everything ought to be done regionally by the Department of Health. That was almost a starting point on the conversations. And then just the level of investment that we have to make to just start correcting some of these deficiencies in public health across the state was pretty staggering when we finally started putting a pencil to it. Yeah.
Well, and I think we know that there's a revolving door on the jail, and it's a lot of the same people in and out, and it's all well and good. It's a wonderful thing to have a treatment program at the jail. But what do you do when they walk out the door? Because all that, we need treatment centers,
Sure.
halfway houses, some recovery places for them to go so that they don't just get out of jail and say, whoosh, I made it through that, got time off, got points on my,
Sure.
record. And they go back and do the same thing.
Exactly right. You got to start somewhere. You got to start somewhere. And that's why there's got to be this continuum, which is, okay, we're now trying to deal with the root causes of what is causing your substance use and mental health issues right here.
Mhm.
And now we're going to walk arm in arm with you as you go through the rest of your life,
Yeah.
not the next 6 months, but the rest of your life in pursuit of sobriety. Jackson County, I will tell you what they did, a little different. And I'm not criticizing anybody. I'm not here to say we made a bad decision. Our commissioners made the best decision that they could make, right? But what Jackson County did was they tried to solve the riddle part of the question that you just asked, which is, okay, we have a program in our jail. Now what? Well, they go immediately from there to a county-based transitional center that, because you got to take away barriers. The barrier of housing, the barrier of education, the barrier of jobs and job training, the barrier of mental health, and a big barrier, core barrier that talk about there is a barrier between them and their own support systems. All the people that I talked with had been completely alienated from the ones that love them the most. And so the programs we're talking about how to, correct those relationship issues too, because we all need love and support. And you get back to the root causes of substance use disorder, they're going to come back to the fact that everybody needs love and support, and the government can't take care of everybody, right? So it was really talking about a very holistic approach to the individual. And serving them. But Jackson County, I thought, did it really well because they created a workforce center.
Yep.
You there, and now you're living over here. Now you're getting you're getting counseling. You're developing the skills on how to work with your families again and reunite with your loved ones. And all of them had kids that they've been alienated from. And there's no wonder, right, why the obstacles are so great. And honestly, why statistically it's so hard for someone to have sobriety for the rest of their lives, because there are so many obstacles in their lives. And you break it down to the personal, interpersonal level. You got to give them all the tools. But Jackson County, if you ever want to see, Brandy, I don't know if you've been over there or not, and you know what I'm talking about that support network all across the way. Jackson County did it really well. They said, we're not going to build a new jail. And I went over there and met with the commissioners. We're not going to build a new jail. We're going to build a workforce center. And they just took a different approach. And there's lots of different approaches. And we're still, again, my role here is, I want to focus on start. I'm a big proponent that if you dream big and you have big goals, you also got to have some wins along the way that creates momentum and opportunity, and it gets people excited because then they can see the vision. If you talk too far away, if we say, hey, you know what, all this is 10 years away, we'll get there. Stay excited, stay energized about it. It's really hard. It's grind. But you break it down and like, hey, 6 months, 12 months, 18 months, 2 years, you know, you start, I don't know if anybody here plays golf, right? Well, if you have a long, if you have a long putt, they don't say, look at the hole over there. They're like, well, find a spot, about 4 feet away that puts you in line and then aim for that that's closest to you. And I think that's also a way about how to execute strategies. If you make the vision and execution too long out there, you don't get the wins and momentum that you want. And everybody's got to have wins along the way.
One more question. You spend a lot of time talking with industry leaders here. Are they on board to help people in recovery?
Absolutely. We're all on board.
Are they willing to do stuff in the workplace to?
They are. And I just want to point out, I believe that the genesis of Healthy Community Initiatives came from our industry getting together. And I believe it was maybe the Envision plan.
Envision.
Industry leaders got together and said, what can we do about our community? What difference can we make? And it spurred HCI,
Right.
correct? Healthy Community Initiatives. So look at the difference you're making too. We just got to get to those measurable outcomes, and we got to have, you've got to have the resources. Happy to answer any more questions. And I'm getting the cut signal back there. I appreciate all the
In
questions.
the interest of time, I want to take just a moment and thank Mayor Courtney for joining us today and answering lots of questions.
Thank you.
While I have the captive audience, just to reiterate some of what you said, Resilient Jefferson County presenting a program on April 19th on ACEs and and trauma and how that affects our community. You are all more than welcome and invited, and there'll be more information on that. Also, I know that everyone here is probably looking for something to do on Valentine's Day, so join us on Valentine's Day at noon back here and bring your honey or your significant other and join us to talk about substance abuse in our community and what we can do in terms of
Will there be
moving
chocolate
forward
there?
with recovery. I'll bring chocolate. If you
Bring a
come, I'll
chocolate. Bring your loved ones. You'll bring the chocolate.